is the front and which is the back of the heart. It's a little bit tricky. But remember on the model, you have the anterior interventricular artery that comes across at 45 degrees. So that's one thing. So what are these little flappy things up top? Auricles. That's something else you want to look for. So I can see that blood vessel in the front. I can see the auricles. Also, who remembers, what's the name of the blood vessel that's between them? The very first one, the very first blood vessel that you can see when you're looking at the heart. Pulmonary trunk, exactly. So you've got your auricles up top, you've got your pulmonary trunk, you've got the anterior. It's interventricular branch of the left coronary arteries right there. Okay, do you remember I said the 3 layers of the heart? What's the very top one? Epicardium. We're just going to take our little probe, and there it is. There's like a thin skin. Can you see it? Say yes, say yes, say yes. I can see it. It's right there. Thin skin. The meat of the heart is called what? Myocardium. And then you'll, it's so obvious. It's right here. The inner layer. Endocardium. You got it. This is a great one. Who cut this one open? Was it Julie or was it Jay? I don't remember, but they did a great job. Okay, it's yours. It's Yvette's. I should have known that. All right, guys. It doesn't matter which one we're looking at. When you're looking at the heart, how do I know which is going to be the left and the right-hand side?
The left is thicker.
Thicker. So this has got to be the left myocardium. This has got to be the right. This guy in the middle? Interventricular septum. Okay, now we got to start thinking. If this is the left side, and it is, what valve is this? Bicuspid, which is also called what? Mitral valve. Okay, so what are these little stringy things? Chordae tendineae, you got it. What hole is this? The hole, not atrium, the atria, that's the right ventricles. The right atria is going to be up in there because it's on top, right? But this is the right ventricle, right? Now this one might be a little bit difficult to see, but there's another valve in here. You can see the chordae tendineae.
Tricuspid.
This is the tricuspid valve up top, exactly, very good. So this marks the right ventricle here. This chamber above, as somebody said, is the right atrium. Then what hole is up top over here?
Left ventricle.
It's got to, not the left ventricle, atrium on top. The left ventricle, we just cut it in half. We just cut it in half. All right? So this is your left ventricle here, this region here, plus this region here. Now, who's good? If this is my chordae tendineae, what's the name of that gigantic chunk of muscle between my fingers? Papillary muscles, yeah. Remember that they're connected to the chordae tendineae. They're connected to the chordae tendineae. All right, so we've got the right ventricle, the right atria that you guys picked out, tricuspid valve that you guys picked out, the papillary muscle, always attached to these. Who are these guys again? Chordae tendineae. This is the left or right side over here. Left side, so what valve has that got to be?
Tricuspid.
Nope.
Bicuspid.
Bicuspid is on the left. Tricuspid is, hey, I'll give you a gold star for trying. All right, that's everything we can see on the inside. And I think we did most of this on the outside with 1 or 2 blood vessels. If this is the pulmonary trunk right here, that's the pulmonary trunk. Who's the big blood vessel right behind it?
Aorta.
Aorta. Now, let's see if they were paying attention, okay? The first major branch coming off the aorta. Before you answer, okay? Yes, you're right. But before you answer, remember that the aorta comes up and arches over, right?
Right.
So the first branch is the brachiocephalic. They cut the rest of them off when they, cut these out. I hate that, but that's what they happen to do because we don't get to see them. And that's it, guys. So on the model, you're going to have, about 12 questions. On this one, This might be a bonus question, or it just might be part of the lab practical itself. Anybody else? Questions? Questions? Thank you. That's it.